Welcome everybody to this week's episode of Cafecito Power Break, where you get to take a break and get some knowledge and have a conversation and join us on just important topics. So I am excited for today's episode. We are going to be talking about Latinos and health and healthcare and the health system, right? There's a bunch of different components on that, so we want to dive in. So I'm excited to have our guest, Mariza. Before I introduce her, I want to share, if you guys are currently following us, we have some upcoming events. So make sure that you guys are tuning in and registering for those events. Just go to unitedlatinas.com/events and you will get our next upcoming events. We have one on May 2nd, Mastering the Art of Building Your Network. We have Overcoming Fear. And we have our next Latina leadership meeting in May. So make sure that you guys are registered for that. And yeah, let's have our cafecito and let's talk with Mariza Hardin. Welcome.
Hi, Sandra. Thanks so much for having me.
How do people usually pronounce your name?
Marissa is usually the easiest. Mariza is totally welcome and what my family calls me.
Okay. All right. That's good. That's good. So this is exciting because you have an organization called Zocalo Health, which I see some of like your passion and some of the things that you do. So tell us a little bit about that and what got you started. What was the reason? What was the problem that you saw in the market, especially since you are for Latinos, by Latinos?
Yeah, exactly. So let's go way back to, I was born in rural New Mexico to, a family that was like most families trying to build a life and family in the United States. My grandparents immigrated from Monterrey, Mexico, and, had to work farm jobs, social service jobs, house cleaning, and healthcare was always hard for them. It was hard for them to understand the U.S. healthcare system. It was hard for them to access services in a rural community. It was hard for them to ask for what they needed when they had an illness or even when they just had questions. They didn't have anywhere to go. As I got older, as a young child, I found myself helping them navigate those services and figuring out what the heck is Medicare, what is Medicaid, what's the difference, how do you fill out all these forms? And back then, everything was in paper. So if you made any mistakes, it was denied and you had to start again. So healthcare is hard for everybody, but especially if you're not from the country, if you don't speak the language, it can be even harder. And it can certainly add complexity if you see physicians that don't speak your language, but also just don't acknowledge that your culture and traditions make you who you are and largely impact your healthcare. So that impacted me as a young child and really steered my focus and passion in healthcare and thinking about how do we rearrange this complicated system to make it easier for everybody to navigate, but especially for our families that really struggle. So professionally, I got a master's in public health where I focused on health policy at the state level, worked with the Obama administration in his first year, thinking about how do we increase access? How do we use some of the public policy programs to do that? And then found myself working for Amazon, which was a really interesting transition because I went from building products and experiences to working for one of the biggest tech companies in the world, thinking about how do we make healthcare more consumer focused. We all love how easy it is to get an Amazon package at our door delivered overnight. And can we take some of those same conveniences and put them in healthcare? So I was intrigued. I took the job, worked for Amazon for over 5 years, helping them build and scale their own healthcare businesses, but quickly learned and realized that all this great innovation is happening in healthcare, but our families in rural communities, our Latino families, continue to get left behind when it comes to innovation, when it comes to convenience, and certainly when it comes to accessible healthcare. So left my job at Amazon, told my family, we're going to do this. We're going to start a business, and it's going to be about healthcare, and it's going to be about making healthcare easier, more accessible, more culturally aligned for the Latino community. So my co-founder, who I met at Amazon as well, Eric and his family, have similar experiences. He grew up in inner city Houston, but also struggled with navigation. So we quickly found a market opportunity around helping Latinos navigate the U.S. healthcare system and then matching them with providers that were not only speaking their language, but culturally aligned with their way of life that came from their community, and kind of taking it back to the days where your doctor saw the whole family, spoke the language, was from the community, did home visits, all of those things that were part of the healthcare system. Maybe in Latin America, we're trying to bring some of those pieces back to your experience with Zocalo Health. So this is a new company. We started about a year ago. We serve customers in California and Texas, but we see so many problems in the ecosystem when it comes to healthcare, especially for Latinos. And as you might know, Latinos don't use healthcare the way it should be used. We put off our primary care visits for 1 to 2 years, if not more. We're seeing people that came in and never saw a physician during the pandemic, and now that healthcare is kind of opened up again, are finding that they have conditions that are unmanaged. 1 in 2 Latinos has type 2 diabetes, and that's a serious condition that we don't talk about enough, and we certainly don't provide the right resources and guidance to our community to manage. So a lot of things to unravel, and one of the best things that's happened since we've launched the company is these types of conversations. It's really just having the discussion around, why don't you get healthcare? What's stopping you? What's scaring you? What are some of the stigmas? What are some of the trust issues? Let's at least have a conversation about it so that we can connect, we can find you an advocate, and we can start to make that journey easier, because our health doesn't get better if we ignore it. It might get worse. And so we have to have the conversations. We have to help people feel comfortable, and then we have to connect them to the right resources. So I love the opportunity just to talk. We may not have all the right answers, but we have to get talking about it.
Oh my gosh. Like, I am loving this conversation because, like, you're bringing up some important points, and I'm passionate about health. I'm not 100, I don't know. I probably am healthy.
Yeah.
But when we think about some of those, you said 1 in 2 Latinos have type 2 diabetes. I was watching a documentary once that said, if Latinos did not eat beans, if that was not part of our normal food system that we were consuming, we would all be dying early of heart disease. Isn't that crazy? Because of the amount of grease and fat and how we've Americanized our food, right? How we've changed. We're not eating how we used to culturally, but we've adapted to the norms that are now, and rightfully so. Some of that food's good, but how do we now learn to, number one, there's a couple conversations here. Number one, how do we live better and healthier as Latinos so that we have preventative more so than that, okay, I just need a good doctor. 2, how do we explain that to doctors and physicians? Because people, I think, and even my generation now is like seeing like, okay, well, doctors don't have all the answers. And maybe it's because of some of the things that you mentioned, being treated like, oh, you're the same as everybody else. And this could be it. No, it's not. You don't know my lifestyle.
Exactly.
So like I'm like, so like, I don't trust doctors. I'm at that point, and like, I don't trust them, and I've been to in my age where I'm like menopause, like in that age group where we're going through that stage in life, and I went to a doctor recently, and he's telling me, well, how do you know? And I just looked at him and I'm like, well, did you know that Latinas and Asian women start earlier, like the process of like, so that's the frustration with the medical industry overall is a problem. So like, how can we re-educate people to, number one, learn to trust a system that is designed to not be trustworthy, right? Because can we trust the instructions of what's coming from that, as well as taking care of our own health, but having systems in place that we do have a healthcare professional that we believe, like, and trust, that understands our upbringing, understands what we're going through, and doesn't shun us like, you're just, here's the box I'm going to put you in, when it's not always the same. How do we tackle that?
No, I love this question because it's what I'm so passionate about. And I think it starts with, we have to empower ourselves to be better patients. And what that means is our health is what happens every day, what time we wake up, what we eat, our children, the things that impact us, our work, everything impacts our mental health, our physical health, and only we know that. And so, doctors are people too. They're on these really tight schedules. The whole system is designed around fast visits, people in and out. And if you don't come to your visit with a list of things written down that you want to talk about, the chances of your physician knowing what to ask you or what's bothering you are very low. And so you have to go in there empowered and ready and prepared to say, these are the things that are important to me, and I need you to listen, and I need you to help me find answers. A lot of times we go in there and we're nervous and anxiety starts to happen, and before we know it, the physician's walking out the door and you didn't get to ask any of your questions, and you leave feeling frustrated and you leave feeling like people aren't listening to you. So I always like to start with, how do we become empowered patients? And that starts with writing things down. If something's bothering you, write it down. If you have a symptom that's happening every morning at the same time, write it down. And then maybe talk about it with somebody, maybe your friend, your Thea, your colleague at work, say, these things are bothering me. I am going to make a doctor's appointment and find an accountability buddy. Did you make that appointment? Do you want me to go with you? Now that pandemic restrictions are lifting, we can take people with us. And sometimes that helps because we get to the appointments and we're just nervous and we forget everything we want to say. But if you have your sister or your accountability buddy with you, they can say, hey, remember you were talking about that pain in your left breast? Let's bring that up first. And so let's start with empowering ourselves and advocating for ourselves that we need this care and we deserve this care. But you also have to recognize that as a patient, you have rights. You have so many rights to ask for your data, to ask what they're writing down in your charts or typing away in their computers now. You have a right to find a different physician. If you go to a doctor and you don't like the way they interacted with you, or you don't feel trusted in that interaction, find somebody else, or start talking to the clinic manager to say, this physician just didn't listen at a level that made me feel heard, so I want to find somebody else. You have to shop around like we do for other things. And I think some people just get really overwhelmed with booking the appointment, showing up, being in the waiting room, and by the time they get to the physician, they're like, get me out of here, I hate this. But as a patient, you have to kind of find that physician that aligns with you. And the unfortunate statistic is that only 6% of US physicians identify as Latino. So if we're trying to find one that kind of comes from our community and speaks our language and understands the culture, we're going to have to work really hard. So that's, another one of the missions behind Zocalo Health is, let's connect Latino physicians to Latino patients in a very accessible way. And so that's how we started with telehealth, because telehealth allows us to have these conversations. If I'm in Washington, but I have a physician that I really love in California, I get to talk to her and she gets to know me, and I get to talk to her every day if I want to, or maybe just once a month when something's wrong. And that's the kind of relationship you should have with your physician. It shouldn't be a 5-minute visit that you check off the box once a year. It should be an ongoing relationship. So I just love talking to people about what can you do to empower yourself to be a better patient.
Yeah. Oh my God. I love everything you just said. Number one, it's important to know everything and write it down, because we forget. We forget. By the time we get there, we're like, oh, damn it, and we'll leave.
Exactly.
And we're like, crap, I forgot to bring this up.
Yeah.
And I love the telehealth model because, yes, we're not limited to just the people that are in our county or that are within driving distance, because everything has become, now we can access better doctors that we're more in line with, that believe the things that we believe in, right? That believe in the way that we look at healthcare. And I think that that's so important about the telehealth model, is you're able to have a conversation and really even more so feel connected, straight, because you're connected to that person.
Yeah, Sandra, one of the exciting findings we've had in the year that we've been live is that people are using telehealth, our platform, for a lot of mental health support. And the stigma for mental health, a whole nother 30-minute conversation for us, but Latinos don't like to talk about it. They don't like to put labels on it. They don't like to ask questions about it. And they certainly don't want to seek out help in person, go to a brick and mortar, sign papers, wait in a waiting room, and then go be seen for an hour with a therapist. But when you introduce telehealth, now they have a tool where they can, everything's done online. You can do it on your phone. You can do it on your computer. You can do it at night when you get home, and you can talk to somebody and you can receive care in your home without maybe the stigma that you would in a physician's office. So telehealth is kind of unleashing this ability for people to connect with physicians around their mental health and start to break down some of those stigmas, because the reality is there's a lot of depression, anxiety, and those things, again, don't go away if we don't talk about them and seek help. And telehealth is just one tool that's helping people to access that type of care more accessibly. And to us, that's a huge, huge accomplishment for our community, because we can't keep ignoring it, and we can't keep saying, we just need more physicians or we just need more services. We have to bring something to our community right away so that they feel like they're heard and they have a way to connect.
Yeah, for sure. Oh my gosh. So this is, and like the mental health subject, which is great because it has allowed people to connect with people and have conversations and vet your doctors, right? You don't have to, like, you can have conversations with doctors and vet, like, who do I connect with? Who am I going to stick to? And I think that's important. My leg fell. And I think that's important for people because you don't know who you're getting when you go to a doctor. You're just like, if you have insurance, your insurance company referred you, and or gives you a certain amount of people you got to pick from. And then if you don't, you're literally Googling and going, eeny, meeny, miny, mo.
Yeah. Yeah, I was laughing because we were talking about our kids, and when my husband and I were pregnant with our first, or we only have one, we did that whole thing where we interviewed pediatricians and we went to visit their offices and asked them questions and asked them about their education. And we found a match. We found one that we really loved and took the time to meet with us and talk to us. But we went through all these steps to find my son a pediatrician before he was even born. But then postpartum came and your world is rocked upside down. And I needed a doctor, and I was like Googling it at 2 a.m, like, who is available tomorrow? Like, I didn't even care. Yep. And that's fine too. There's urgent care needs, but women, we have to do the same things we do for our kids for ourselves. We spend so much time like vetting the perfect pediatrician and the perfect school and the nanny and the babysitter. And we have to do that for ourselves. And sometimes when we need it the most, we're scrambling. We're like, oh no, I don't have a doctor. I just need somebody. And then we go to that somebody and it's not the right fit. And then we kind of leave that frustrated. So I encourage all moms to kind of take that same due diligence that you did with your children for yourself, because that is the investment that pays forward tenfold, because when you take care of yourself, you can take care of your family, you can take care of your career, you can take care of your personal life. It's all connected.
Yeah, for sure. I mean, if we are not functioning properly, we are not going to be able to perform properly. So in any aspect of our lives, be good parents, be good employees or business owners. So they all kind of take in, they all matter. They all matter. How is the how is the adaptation of the medical industry to more holistic means? has that combined yet in any way? Like, where we don't want, prescriptions, we want more like, what are alternate methods of healing? Is that?
Yeah. I mean, again, you have to find the physician that's aligned with your culture and your beliefs, and that takes some time. I think there is more openness for physicians to ask questions around what's working for you. What are some of the things that you do that are consistent and that are part of your belief system? But again, you have to find those physicians. At Zocalo Health, we gave our physicians the opportunity to do 30-minute appointments, 45-minute appointments. And what that allows them to do is ask those questions like, Sandra, what kind of herbs do you like to use daily? Do you drink tea? Do you like to do yoga? Do you like to light candles? Like, what are the things that make you feel like
Yeah.
yourself and draw calmness to you. And that allows us to better provide your care plan in alignment with your personal needs. We get a lot of people that come to us and say, I don't want to take any medications. I
Yeah.
want to try to heal myself from the inside. I want to try meditation. I want to try stress reduction. And our physicians are absolutely open to that and want to hear that before they start prescribing new things. And that happens with the relationship. And that happened. And so, again, that kind of loops us back to the importance of finding a physician that you see regularly. Because when you trust the physician and the physician trusts you as a patient, they're going to say, let's try a couple of things first before we go to medicine or before we go to this rigorous treatment plan. And if they know that you're going to kind of follow directions and be an empowered patient, then I think they're a lot more open to you bringing those types of traditions into your care plan.
Yeah. Oh my gosh, this is like all of these are all important factors. Like even going in, because you have to go in sharing. They don't necessarily always ask, but I don't know about the network. I'm interested. The Zocalo, you guys probably have them trained to think the way that is a little bit more broader. But most won't ask you, well, how's your eating lifestyle? What are you consuming every single day? Like those are questions that we think that are critical to our health and yet are not being asked by doctors. And some of the doctors are in a position where, who are you to give medical health advice when you don't look exactly 100% healthy? So like we've changed. And I think that is the beautiful part about the evolution of Latinos, even in healthcare, is really getting to the point of understanding. It's not just listening to the person that's got the robe on. It's really listening to yourself and understanding your own needs and saying, you know what, I need somebody to get me and understand me versus giving me a pill that I don't want to take that's going to cause all these other issues. And we've moved past that, I feel. Like we've moved past that just blindly taking what is prescribed and just doing the due diligence, which will be on that for the rest of our lives. Right. That's what that industry wants to happen. So that's why a lot of people are jaded a lot about the healthcare structure, but we still need individuals and healthcare professionals and doctors that can support us in this new way of thinking that we want to live more naturally. We want to do, what is it that I need to adjust in my diet, or what is it that I need to adjust in my practices every day to live optimally?
Yeah, absolutely. And healthcare is very much a puzzle that you have to put all the pieces together. Yeah. And it starts with a primary care physician, but then they need to bring in a nutritionist if that is your need. They need to bring in a mental health provider if that's your need. They need to bring in a chiropractor if that's the need. Like you have to bring in your team, and that team has to coordinate to meet your needs. And we've had people that have come to us and said, I have type 2 diabetes. I went to my physician and he said, stop eating tortillas, stop eating beans, stop eating, all the things that you eat as a family every day. They said, no, you need to eat fish, white rice, and vegetables. And can you imagine like living your whole life with all these amazing foods and your family's cooking for you and you go to all these family gatherings and you're going to be eating fish and rice? That's going to last for like 3 days. And then you're going to be like, forget it. This is not my life. This is not what I want. And so it's, those opportunities to align with you culturally and say, you know what, enjoy your tortillas. But let me give you like 3 things to do that can make your tortillas a little bit healthier, or you can add some things like let's add some vegetables to that pot of beans you're making on Saturday. There are all sorts of things we can do to alter and improve your diet. That's not like taking away your identity. And that's so important because people will not change behavior if it's hard and if it doesn't align with the lifestyle that's happening around them. And sometimes lifestyle modifications are needed to improve your health. Maybe you need to go to bed a little bit earlier. Maybe you need to drink more water. Like there's things that we can do, but you have to have that relationship with a physician that understands your environment, your home, and your family. Like that family means everything to our community. And if we're not acknowledging the larger family unit, you can't just treat one person.
Yeah, for sure. I mean, you brought up something. So I used to be the empanada maker in my house. Like for every gathering, the Thanksgiving, like everyone's like, Sandra's, you bringing your empanadas? And I'm like, they're the best. They're gone. right? And I used to make them just naturally, right? Because we learn how to cook from our moms, and then we just cook, and it just comes out like gold every single time,
Yes.
right? And I was always, and then I became vegan.
Wow. That's
So
a big shift. I love
that is
it.
a big shift, because I started realizing as I'm aging is like, you know what? I think I need to check myself. I need to be more conscious of the foods that I'm going to eat. And I realized that food is medicine. It's not
Yes.
just there for gluttony and just consuming as much, even though, trust me, I have my sugar bouts.
We
I
all
need
do.
sometimes a muffin and some sugar.
Oh,
But
yeah.
but I became plant-based, and then so I was like, even for my son's school, like for all these cultural events, I'd be the teachers would ask like, hey, is your mom making the empanadas again? And like, thankfully it was up to his senior year, because I was
Oh, wow.
plant-based after that, and then I was not
No, have you tried to make vegan empanadas?
I
How do they taste?
I haven't sold him on them
Okay.
yet, but I eat them.
Yeah.
Because anything fried to me is like, oh, it's good. Just put anything, and if it's vegetables, because I eat now to live. I don't,
Right.
even though I live to eat, because I love food. I like want to eat all the time. But I'm more intentional about what I'm consuming, as like, this is nutritious for me. This is going to power up my brain. This is going to be good for my liver. So I
Right.
eat
I
more
love that.
now with intention of like, oh, I need beets. I've never grew up on beets. Vegetables, literally vegetables was lettuce and tomato
Right.
on the side of rice and beans.
Yeah, my grandparents used to get like the canned delivery of the peas and carrots in a can.
Yeah, like, and we didn't even eat that, because it was just like, I'm like, carrots in a can, like they were just. But now I realize, like, man, my extent of vegetables was literally very limited. We didn't grow up with vegetables, not even avocados, because we're Puerto Rican, but we should have. I think Mexicans have that advantage, because that's what I eat now.
Right. I know. I love that we know better now, and we do better, for our families. And it doesn't have to be one or the other. Food should fit with your life, should make you feel like a better person. And once you make those connections, and it's easier to make those decisions, and it's easier to start to incorporate things that make you feel good. And you have to get in tune to that before you start making changes. And I would love to chat more about how vegan transition was for you, because that's fascinating to me. But love that you're kind of mixing it into your culture and still keeping the things that are important to you and make you happy.
Yeah, for sure. Yeah, I still make rice and beans. And I don't have any additives. Like, it's unfortunate, my son, because we grew up on sazon, right? But you learn that what's actually inside sazon, and you realize this is not good for us. This is not good for us. And I know many of you watching are like, I use that all the time. But
you're gonna get some hate now.
But I think that's part of healthcare, right? Really, because did we have sazon back in the 1500s? No, 1400s? Like, no, we use natural herbs and natural ingredients that were from the land. So I think that is what I've learned through my Latina, like going through veganhood as a Hispanic woman that still likes flavor and taste and wants to. And I love food.
Yeah, you don't want boring food.
Yeah. We want to eat good. We want to eat tasty, but we are now evolving to being more health conscious. But saying all that to say that still you have earaches, you have things going on as you age. There's things, and you want to have a trusted individual that can get that and not say, oh, well, you should start eating meat because of this. And I'm thinking, well, you don't really know what you're talking about,
Right.
But someone that could understand how we are evolving and wanting to go back to more of our roots and herbs and natural spices, and how can that help our own health to kind of remediate some of the things that may be going on in the diabetes. I don't know what it's going to take for that, but
a lot of conversations. It's first just having the conversation, and you never force anybody into a healthcare visit or a lifestyle change. It's about getting trust from them, and then guiding them through that journey and supporting them, whether it's yourself or a family member. I think it starts with just talking.
Yeah, for sure.
I appreciate you hosting today's topic. It's so near and dear to my heart, and would love to continue the conversation with all the members, and of course invite all the members to try Zocalo Health. If you reach out to me directly, I can give you a promo code to have a free membership for a couple months to try it out. But it's definitely something we are really excited to share with our community.
Oh, that's awesome. Yeah, we'll send it out to our members too. We'll put it
Yeah,
in an email and send it out because I think that's
love
so
it.
important. I love it. I love this conversation. I hope you guys got something from this conversation. Eat better, live
Yeah,
better, and then have a good advocate that's a doctor on your side. And Zocalo Health
absolutely.
has vetted a lot of individuals that are more
Mhm.
inclined to understanding and listening to where you're at in life, whatever
Exactly.
stage you're at in life. So I think that
Yeah.
that is awesome. Mariza, it has been such a pleasure.
Thank you
Any
so much.
last final words that you want to
No,
share
I
before we
am
close out?
so honored to be here. So thank you so much for hosting the conversation.
Awesome, awesome. All right, guys, make sure that you are following our pages. Make sure that you're registered for our next upcoming events. Have your cafecito, take a little break, and then now get to work and get your
Yeah.
stuff done.
Have a great day,
All
everyone.
right, guys, take care. Be well.